Namaste. I am Dr. Shantakumari from Mata Ayurveda Eye Hospitals, Thiruvananthapuram. Today let us discuss something about keratoconus. Keratoconus is an eye disease in which the shape of the cornea is conical instead of spherical. So cornea is the externalmost part of the eyeball and it is very transparent and also is spherical in its shape. When the cornea becomes conical in shape instead of spherical, the term keratoconus is used. And what is the symptoms? The main symptom is blurring of vision and difficulty to see distant objects, just like in short-sightedness. So usually there is a question that anyway it is a very small anatomical defect, and just like any other structures, suppose my forehead is little broad or my fingers are short, like that my cornea is little conical in shape, so what, is it a serious issue? People used to ask this question. Normally any small structural changes, in many structures it is not a serious issue, but as far as cornea is concerned, it is something serious, because the shape of the cornea has an important role in the function of the eye, the physiology of the eye. Let us consider that aspect first. We know the light rays coming reflected from the object passes through the eye in a parallel way and reaches the eye. Then it passes through the eyeball to reach the back of the eye and to focus on a particular point in retina. Retina is the innermost, posteriormost part of the eyeball. And then only the biological changes take place and the nerve impulse is formed, and later, after conducting it to the brainstem, we get the sense of vision. So in this part, these structures through which light rays passes are known as refractive media, because and when the light rays passes through this media from cornea to the retina, the light rays should come to converge, and it is possible only by refraction. It should be refracted in such a way to focus on a particular point. And the focusing, in short, the focusing of the light rays on retina is the sum total of the refraction happening in these four media. Of these four media, first comes cornea, second comes aqueous humor, third, just behind that, lens, fourth is vitreous humor. So cornea comes first. That means light rays comes and touches the cornea first. Then itself, it has to start the refraction. For this refraction, its shape is very important. We know, just like in any optical medium, this focal length and radius curvature, these are very important. So the shape is very, very, very influential. So once the refraction at cornea is not normal, there is no chance of getting normal vision by focusing on the retina in a normal way. This is the point. So we have to keep the cornea in normal shape. Now coming to the treatment side. Usually people will forget it, all these details, because they will be experiencing some difficulty in seeing distant objects only initially. So most often it will be mistaken for myopia or short-sightedness, and we start to use myopic lens. It means glasses for short sight. And sometimes what happens, it will be, the power of the glass will be increased to correct the vision, and finally one point will attain when vision is not corrected even after increasing the power of the lens. Then starts to go for detailed investigations and checkups. Then this point comes that there is keratoconus. That is why vision is not corrected with the normal glasses. Then contact lens will be tried, and later we'll go for further mechanical steps. Finally, there will be some advice that cornea can be replaced by keratoplasty, something like that. By this time, there will be blurring of vision, or sometimes headache or watering, some points like that. So we have to correct it. In this point, when there is contact lens also is not giving good results, then the patients start to inquire about alternative systems or any other medicinal trials. Now, what can Ayurveda do in this stage? According to Ayurvedic principle, this is the predominance of the vitiated vata, and we have to correct it. For that, there are different steps. In Ayurveda, we are taking 3 steps for the treatment. One is to stabilize the structural characteristic features of cornea. For that, internal medicines have an important role. There are many effective medicines for intake. Mainly it is medicated ghee. It will stabilize the cornea. And second is different types of practicing eyeball movements and inducing massage and some scientific way of pressure, so that the cornea can be, since it is very elastic in nature and also its movements are very flexible, that can be performed by scientific type of movements. For that, we have to maintain the elasticity. There are different type of procedures. For that, oil application on the head, according to Ayurvedic principles, is very important. Main method is either Shirodhara or Shirovasti, and then comes this Nasyam. Nasyam means administration of medicines through the nostrils. By these methods, we can make our CNS and also the channels and also the muscles more healthy and more flexible. And side by side, if you are practicing this scientific mode of eyeball movements, it will help to bring back the shape of the cornea to normal size. By these 3 methods, one is extraocular treatment procedures, then internal medicines, then special ophthalmic treatment procedures. There the procedure of application is very important. We usually administrate medicines by the method Tarpana. Tarpana is a very particular, very modified method of medicine application in the eye, in which medicine is kept for the calculated time inside the eye using a boundary around the eyeball. It will make the cornea to be more strong and healthy and to be in the to come back to the normal shape. By these methods, 3 types of steps, we can control keratoconus to a great extent and to avoid surgical procedures and other mechanical methods in a very good way. And we can protect our vision and protect our eyes also. And thank you. All these things are shared by Dr. Shantakumari from Mata Ayurveda Hospitals, Thiruvananthapuram.